Welcome to Prevent Connect Campus. Our web conference today is titled Sexual Violence on Campus, Strategies for Prevention, CDC's Coordinated Effort to Sexual Violence Prevention on Campuses. My name is Ashley Klein-Jimenez, and I am honored to be here with you all today. Prevent Connect is a national program of the California Coalition Against Sexual Assault, sponsored by U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or CalCASA. I am so excited to pass the floor over to our guests from Centers for Disease Control and Prevention and the American Public Health Association to hear about all of the exciting work that CDC is doing. But first, we would really love to know a little bit more about you all. So if you would let us know in the text chat what specific role you play in campus sexual violence prevention, we would really appreciate that. And you can go ahead and let us know in the text chat, and people are starting to answer. So we have victim advocate, prevention education specialist, Title IX coordinators, many different roles that you all are playing when it comes to sexual violence prevention. It's great to see such a diverse group of people. We have advocate, we have, wow, this text chat is going quite fast, but you would expect that with close to 300 people. We have lots of prevention educators, primary prevention coordinator, prevention specialist. We have an advocate, education facilitator, self-defense trainer. So there is just a diverse group of folks in this room. Thank you all so much for joining us. I now want to, as promised, introduce you to our presenters today. So Dawn Fowler is from the National Center for Injury Prevention and Control, Centers for Disease Control and Prevention. Dawn, thank you so much for joining us. How are you today?
I'm wonderful, Ashley, and delighted to be here. Thank you.
Thank you so much. And Jenny Dills is also from the National Center for Injury Prevention and Control at the Centers for Disease Control and Prevention. Jenny, how are you today?
Hey, I'm good. Thanks for having us.
Thank you for being here, Jenny. And we are also joined by Mighty Fine from the American Public Health Association. Hi, Mighty. How are you?
Hi, Ashley. I'm just wonderful. Thanks.
Great. Well, thank you all again for being here. I am going to go ahead now, Dawn, and I am going to give you the podium, and it is all yours.
Thank you, Ashley. Our gratitude to you and to Prevent Connect for your support and facilitation of this very important and valuable webinar. I just would like to say good afternoon and again welcome to all of the attendees to this web conference. The webinar ultimately represents a springboard of a description for CDC's portfolio of sexual violence prevention efforts and activities, and specifically for college and university campuses. As Ashley indicated, I am Dawn Fowler, and I'm the team lead at CDC for our National Rape Prevention and Education Program. The acronym for that is RPE. It's through our RPE program, as legislated by the Violence Against Women Act, that CDC funds all of the state public health departments in the U.S. and some territories. That's 55 grantees in total across the 10 public health regions. And we fund these entities to conduct rape prevention activities in their states and territories. We know that some of you, or even many of you, have actually worked with the RPE program in your area. And as much as we here at CDC are committed to providing information and guidance to our RPE grantees, we're also very committed to the broader dissemination of our products and information sharing with the field. So the purpose of this web conference is to provide to a wider audience of important campus-based stakeholders information on CDC's sexual violence prevention efforts and activities. We see this as a body of work specific to college and university campuses. So I'll present on the first set of slides to provide you with some background and information and some context on the development of CDC's Campus SB sexual violence, that is, prevention portfolio, and a bit about our guiding perspective for implementing these efforts and activities. And then Jenny Dills, my colleague here at CDC, and Mighty Fine, our colleague from APHA, will present on the remaining two sections of the web conference, which will include first knowledge content and then the program action or implementation piece of that knowledge. In terms of the key objectives, this web conference dovetails with the release of CDC's new technical assistance document entitled Sexual Violence on Campus, Strategies for Prevention. So Jenny will present on the document in just a few moments and provide the important overarching components of our campus prevention framework, which is the first objective, to provide some of the knowledge base and content. The second objective, to identify evidence-informed strategies to prevent sexual violence on college and university campuses. Jenny will also present on what works in sexual violence prevention, again, capturing the knowledge base from research and practice, from CDC's technical package, which is currently available to the field and represents the best available evidence in sexual violence prevention. The third objective for the web conference, Mighty will describe CDC's action planning team process, which is the program action, or again, the implementation arm of our campus sexual violence prevention efforts, where we are actually putting the knowledge into action. And lastly, the fourth objective, to identify steps for engaging in the action planning process. Mighty will provide us some information on those next steps. Next slide, please. With that, just a little background on how this started for us in a way. But you must know that individual campus-based efforts have long existed for CDC, and we've always had some connection between our RPE grantees and other grantees and sexual violence prevention work with colleges and universities. A more coordinated effort, however, on our campus sexual violence prevention efforts really took flight when the White House Task Force to Protect Students from Sexual Assault came to us here at CDC to ask that we convene researchers and practitioners to help to determine what the best practices are. So it was at that time that we convened two meetings, of which I will talk about in just a second. We also contributed to the Not Alone report of the task force with two specific documents from CDC, one on evidence-based practice in sexual violence prevention, and a second was a program scan of our national RPE program to actually report the college and university campuses that our RPE grantees have worked with. Ultimately, the work of the White House Task Force and the Not Alone report laid a foundation for CDC to begin to coordinate and coalesce around this campus, broader campus work. Next slide. So the White House had specifically charged CDC back in 2014 to convene a panel of experts. And we did this in collaboration with the Justice Department's Office on Violence Against Women and the Department of Education. And this was in an effort to identify emerging promising practices to prevent sexual violence on U.S. college and university campuses. In response to this charge, the two meetings held last summer, the summer of 2015, the first meeting was a think tank meeting, and we convened sexual violence and campus professionals and stakeholders. And the second meeting was an action planning meeting, which involved CDC's rape prevention education RPE grantees and their campus partners. In preparation for both meetings, CDC also partnered with APHA, the American Public Health Association, and several federal agencies based on their expertise and contribution. Of course, DOJ, the Office on Violence Against Women, and also the SMART Office, the Sex Offender Sentencing, Monitoring, Apprehending, Registering, and Tracking Office, as well as the Department of Education. The goal of the first meeting, the think tank meeting, was to gather and share information to inform the development of sexual violence prevention guidance for RPE grantees. And the think tank meeting was invitation only. It was a working meeting. It engaged over 30 subject matter experts representing all kinds of organizations and entities, including sexual violence prevention practitioners, college and university administrators and staff, prevention educators, researchers, law enforcement, CDC's RPE grantees, students, federal partners, and sexual violence resource center staff. CDC TA document, of which Jenny will share shortly, provides the specific content and guidance as a knowledge product that resulted from not only the think tank meeting, but the action planning meeting as well. The purpose of the action planning meeting was to provide an opportunity for RPE grantees with developed, convened state teams to integrate the think tank guidance into multi-year actionable plans to prevent sexual violence on campuses. The state teams are made up of the state RPE coordinator from the Public Health Department, staff from the State Sexual Violence Coalition, and representation from campuses or universities. This project represents the action or implementation effort from the knowledge, of which Mighty will discuss after Jenny's presentation. Across both the think tank meeting as well as the action planning meeting, there were a few key guiding pieces. One, Prevent Connect's existing national scan of campus efforts served as foundational material to provide info on the state of campuses. Two, we have to make sure the brainstorming process that we used during the think tank meeting to determine the best practices was strategic and systematic as possible. And then three, through the action planning meeting with the state action planning teams, we had to make sure that the key stakeholders were included on the team. This is always about the importance of the right partnerships at the table for action. And lastly, the action planning process, which was facilitated for the action planning teams during that meeting. And you see here the steps here to guide their efforts or plan of action. Next slide, please. So to sum up the overarching parts to date of CDC's approach to campus sexual violence prevention work, these are the areas of focus, and they include partnerships, technical assistance, program implementation, and research, and ultimately putting the knowledge into programs on campuses and their campus-serving organizations for action and change toward sexual violence prevention. Next slide. This slide is just another representation of CDC's campus sexual violence prevention approach. Having focused in these areas and continuing to do so, CDC will also continue to address the necessary gaps. In terms of partnerships, we've been very deliberative about who is needed at the table based on their expertise. And you see here the list under the partnerships box of all of the folks and entities that we have engaged and have benefited from. And then technical assistance, those documents, again representing practice and research knowledge, the importance of practice knowledge alongside research, the dissemination of two important publications, CDC's technical assistance document, you'll hear some specifics in just a moment, and then CDC's technical package, the conglomeration of the best available evidence to date. Program implementation is the next focus. The action arm, working with APHA as an important partner with the state action planning team. And that is where we actually take the knowledge and apply it in programs and action. And then research to address the gaps in knowledge with CDC's funded projects. And some of those you all are already aware of and may be implementing as we speak. For example, CDC has funded the Green Dot study, certainly to increase positive bystander behavior, to change social norms, and to reduce sexual violence, of course, and other forms of violence perpetration and victimization, and the study of that on college campuses. And then we've also funded here at CDC the Real Consent Study. And that program was found to be effective in decreasing sexual violence perpetration and increasing positive bystander behavior in a sample of college-aged men. And then an ongoing study where the Campus SAVE Act and other policies, as well as bystander interventions, are being evaluated for their effectiveness. And upcoming in early 2017, a sexual violence climate survey for historically black college and university campuses will begin. CDC is partnering with DOJ's Office on Violence Against Women, OVW, and the National Institute of Justice, NIJ, on this project. And we ask that you please stay tuned for more information on this important work in the new year. So just to reiterate, next slide please, yes. Just to reiterate and emphasize the release of CDC's Technical Assistance Document, Sexual Violence on Campus, Strategies for Prevention. Again, as a tool for guidance, the content in this document combines the findings from the think tank and action planning meetings with what we know about sexual violence prevention. And it should serve as a starting place for practitioners and campus partners to plan and implement their sexual violence prevention strategies on their campuses. So hopefully you'll see from this brief background the knowledge to action framework approach as we focus on the 4 areas: partnerships, technical assistance, program implementation, and research. Those are the areas of focus to date. There will potentially be more, but what you can count on is that there will be more information, tools, research findings, webinars that will be coming out for your guidance and use. So at this time, Jenny will provide some important content to serve as the prevention framework from the technical assistance document in the next phase of this web conference. But I'll turn it back over to you, Ashley. Thank you.
Thank you, Dawn. Really, really great to hear all of this work and to have you go through it, so thank you. Anna, I saw that you asked a question in the text chat. I was just trying to get a little more clarity, so if you would use the text chat and let me know. We are interested, Jenny, before I pass it over to you, I think we want to know from the audience, have you read CDC's Sexual Violence on Campus Strategies for Prevention? And so I am going to give you that option, and you should see in the bottom left corner where you can provide that feedback. So it's just, have you read it? Yes, no, no answer. I will assume that you are currently reading it as we speak. But it looks like folks are voting, and so I am going to go ahead and share the results. And it's still coming in. You can see things are shifting, but it looks like over 65% of you, it's going down, have not yet read it. So I have put the link to the document in the text chat, so you can go ahead and access it. Jessica, I just put the link. If you look up, and I'll put it in there again. But we encourage you, as you go through today, if you have not accessed it yet, to go ahead and read that. Jenny, I'm going to pass the podium over to you now. As soon as I find your picture, we have so many people joining the session. There we go. So there you go, Jenny. It's all yours.
Great. Thank you so much, Ashley. And thanks, everybody, for joining us today. I'm pretending not to watch the number of people in here right now, and instead just focus on the few people in the room with me. So, as Dawn talked about and as Ashley mentioned, we just released this document that we hope will be useful for you all in kind of laying the foundation or enhancing the prevention work that you are already doing on college and university campuses. And dun dun da da, here's the framework. It is this 5-component framework that we really think integrating all of the components will offer an opportunity to implement prevention efforts that will have a greater impact on the reduction and prevention of sexual violence on campus. So as you know, in the Department of Education's Title IX guidelines, prevention is outlined as federal guidance that colleges and universities must follow. It's important for colleges and universities, though, to move beyond compliance in order to create real, true culture change that will prevent violence from happening in the first place. So implementing a robust prevention effort is invaluable to fulfilling the spirit of complying with federal guidelines, and the framework that we outline will hopefully help you, move beyond compliance and into that really robust prevention work. So the 5 components that we outlined after our days and days of meeting with the think tank and action planning meeting include having comprehensive prevention, focusing on infrastructure, directing messages at the right audience, having partnerships in sustainability, and it wouldn't be a CDC document without some evaluation love. So I'm going to talk through each of the components and give some definitions and examples, and then we'll talk through some of the Stop Sexual Violence technical package strategies that can be applied on college and university campuses. So the first component is comprehensive prevention, and there are lots of ways that folks in the field talk about comprehensive. Some folks talk about it, rightly so, in terms of having primary, secondary, and tertiary prevention, so prevention efforts that strive to both prevent it from happening in the first place and reduce recidivism and adverse health outcomes after an assault has occurred. For the purposes of our document, we are defining comprehensive prevention as strategies and approaches that complement and reinforce one another across the social ecological model. CDC loves the social ecological model. There are many of us in the world who have it actually tattooed on themselves. There is so much love for it in the world. So some of the pieces that we heard specifically from folks at the think tank and action planning meeting in terms of comprehensive prevention are to implement prevention efforts across the social ecological model, which includes strategies at the individual level, the relationship level, the community level, and at the societal level. And in the next slide, I'll give you an example of what that kind of looks like to have pieces built out across that SEM. We also heard from folks repeatedly about the necessity of incorporating the principles of prevention. These 9 principles of prevention come from a Maury Nation article that has widely been used in violence prevention for years. So this includes making sure that you have identified the right audience and that messages are received multiple times to ensure that a sufficient dose of exposure to the intervention is achieved, using well-trained staff, using varied teaching methods, having a theory driving the work, being developmentally appropriate for the audience, being socio-culturally relevant for the audience, focusing on enhancing positive relationships, and using outcome evaluation to determine whether a policy or program has worked. We also heard over and over about the using data to make decisions. One way we've heard about this coming up quite frequently with college and university campuses is with climate surveys. So for example, a climate survey can be used to tell us about students' perceptions of safety, knowledge of services and resources, and attitudes for prevention. And that kind of information can help us make decisions about staffing positions, needs assessments, finding out the prevalence of the problem on campus, all of which can help us refine and further enhance our prevention work. We also know that it is incredibly important in public health to work across multiple disciplines and sectors to create a prevention-focused community response team. So in partnerships and sustainability, we'll talk a little bit more about who those might be across a campus, since campuses are diverse and there are lots of rad people to engage in your prevention work. We also know from this work and from other prevention work in the field that having prevention and response at the table is equally important. with the goal to end sexual violence, we want folks who are working on prevention and folks who are there to respond in the event that an assault occurs. We want everyone at the table. So prevention staff should be abreast of relevant policies and practices when it comes to responding to sexual violence, and prevention staff should be able to make the appropriate referrals on and off campus to meet the needs of the survivors. In that vein, we really encourage working with community organizations and local rape crisis centers in the community, if those are in the community where your school is. This can ensure coordination of prevention strategies in the community and on campus. This may, in addition to rape crisis centers, this may include local law enforcement, organizations that serve the LGBTQ community, victim service centers, legal aid, social services, health centers, and domestic violence shelters in the community as well. And finally, and most importantly, I would say, in order to ensure comprehensive prevention, we want to work to address gender-based violence. So we really encourage campuses to work to counter messages and attitudes that adhere to traditional gender norms. Prevention strategies can use a gender equity perspective, and work to promote healthy sexuality and healthy intimate relationships on campus. And we really encourage these strategies to be intersectional, so working to disrupt multiple systems of oppression like sexism, racism, and homophobia, include individuals and survivors who identify across the spectrum of gender identities. So this next slide shows just one example of how a campus might have comprehensive prevention activities across the social ecological model. This is obviously like peak dream, where funding and resources and staffing is just unlimited and you can do all of these things. But I think it is possible to have, a modified version of this for whatever resources and staffing and funding you have at your disposal. So at the individual level, focusing on building bystander intervention and healthy relationship skills. At the relationship level, engaging coaches and athletes to talk about peer norms, dorm-based interventions that can, again, address bystander intervention. At the community level, looking at ways to promote the culture of safety and respect. A social marketing campaign may be a good way to do that. And hotspot mapping, so identifying spaces on campus where violence may be more likely to occur or where students have a perception, lack of perception of safety. And finally, the big societal changes like policy change, strategies to halt excessive alcohol use, and strengthening enforcement and encouraging reporting policies on and off campus, all the while having consistent messages across campus policies and programs. So this is just one example. When we, as we move forward, I'd love to hear how folks are doing this in their communities, what ideas are bubbling up to have a comprehensive approach. So our next component is talking about infrastructure, which for our document we defined as the basic organizational systems and structures needed to effectively implement sexual violence prevention strategies on a college or university campuses, sort of the nuts and bolts necessary to be effective. So as we mentioned with the principles of prevention, using well-trained staff, specifically staff who understand and have a skill set in violence prevention is immensely helpful. Using standardized training so that students, staff, and administrators are receiving appropriate training for their role in prevention, and that prevention messages across different audiences are consistent and reinforced over time. We also really encourage hiring a dedicated prevention staff. Where possible, we know resources vary, but so often we see a victim advocate working 90% on advocacy and having 10% of time less for prevention, and folks are certainly successful at this. But where possible, we'd love to see a more concentrated effort of prevention with a full-time staff person to focus on it solely and be able to partner with the victim advocate and other staff on campus to build out that comprehensive approach. And in that arena, we also seek to institutionalize prevention. And by that, we mean that prevention is an integrated priority into the campus's organizational framework. So making prevention part of everyone's job on campus, from students to staff and administrators. And part of the way to do that may be to create a team or a work group or a committee that can serve as the hub for cross-campus collaborations on sexual violence prevention and response. Faith communities, public schools in the community, students, Title IX coordinators, Greek life, women's centers, campus safety, the list goes on of organizations that are all invested in a safe community and all have a stake in preventing sexual violence on campus. We also have heard the need to foster relationships with referral services. Excuse me, so inevitably survivors will be in the audience, and a strong relationship with support services, counselors, community rape crisis centers, and advocates is necessary so that survivors are acknowledged and being met with the resources that they need. We also, we have a big focus here in the Division of Violence Prevention of working across types of violence. And we see this as a necessity on college and university campuses too. So forming partnerships with wellness programs, addressing sexual violence, intimate partner violence, bullying, suicide, and stalking, working with the wellness programs on campus that look at alcohol abuse prevention, pregnancy prevention, sexually transmitted infection prevention are just a few areas where risk factors, there may be overlap in risk factors, and where addressing one may have an impact on reducing the other campus issues as well. And just as a side note, and I think we're with the choir here, so I hope we all know this, but when partnering around association between drugs and alcohol and violence, we want to make it really clear that alcohol and drugs don't cause violence, but that they are maybe contributing to perpetration and victimization on campus. So being mindful that victim blaming should never occur and always be taken into consideration when developing prevention messages. And finally, tracking back to the fact that survivors are going to be in our audiences is using a trauma-informed approach. This means prevention efforts should strive to support survivors' needs, avoid victim blaming, and not re-traumatize a survivor in the audience. Okay.
So Jenny, if I could just stop you really quickly.
Sure.
First, both Megan and Stephanie, it sounds like you were speaking to them when you were talking about advocacy and prevention often being one person. I think that's probably very true for many folks that are joining us today. So hiring a dedicated prevention staff is something that is very. I think it's something that folks would love to see and would love that.
Yeah.
The other conversation, so Rebecca said, given how much capacity it takes to fully engage with primary prevention, what should be expected in year 1, 2, 3, et cetera? And prevention, I think one of the things that we often talk about is that prevention really takes time. Yeah. It's something that has to be planned. And so Kelly, in response to Rebecca, said, year 1 is maybe community assessments of resources and needs, and then you build from there. But I just wanted to see if you had any other thoughts around that.
Yeah, I would just echo that it takes time, and in the first 6 months, in the first year, hiring staff may be the greatest success that you can have, and starting to get into some of those needs assessments, as you said, and see kind of what the scope of the problem is on campus.
And if I could just add to Jenny's comment, Ashley, this is Dawn, that it's similar to the understanding that I know quite a few of our friends and colleagues here, the attendees, have heard, that when you implement, for example, evaluation or a climate survey, you can almost expect that your numbers may go up before they go down. And so that, again, is about sort of the time that it takes to see the shift. So, I mean, you know, a part of our approach is also patience, because we know what it takes to get things implemented, the time that it takes.
Great. Thank you both so much.
Yeah, thank you. This is an awesome discussion. I'm getting a little bit of dizzy vertigo from watching all the comments, but it's awesome to see you all engaging so much with each other. And hopefully we'll get to more of the questions. I'm seeing things pop up that I think we're going to address in a few slides. So hopefully we'll get to it, but I think there'll be time if we don't. So audience, this refers to the recipients and the observers of the prevention messages, the campaigns, or strategies. So, you know, being really mindful that this is the point. These are the people we want to reach, and we want to engage a variety of folks as the audience. So to do that, first and foremost, it's important to identify champions throughout the campus, different sectors and communities that exist on the campus, identifying champions who can help make and keep prevention visible. Champions can be leadership, they can be staff, and especially students who can elevate prevention in public conversation and advocate for and ensure resources are available to continue the work. And once we have those champions at the table, being mindful that the messenger matters. For some, it will be important for the message to come directly from leadership, perhaps as far up as the board of curators. For others, it may be more effectively heard from a trusted peer. Tailoring prevention efforts to specific communities. So, you know, as we said, different communities exist on campus, and there's no one-size-fits-all primary prevention programming. Each community has different needs, and those needs should be met with programming that is culturally informed and specific to the community. So we should be intentional to include historically marginalized communities on campus. This can include immigrants, people of color, LGBTQ, disabled, and other marginalized students. This also includes international students and study abroad students who are on campus and may be on campus for a semester or a year or for a full term. Including the audience, the target audience in the planning, implementation, and evaluation of programming is also key to making sure that those messages will resonate. And in addition to tailoring prevention efforts to specific communities, also tailoring and planning for differences in types of institutions. So characteristics of schools should be taken into consideration and thinking through specific strategies and policies to implement. So a state college that has 20,000 students may have different needs than a community college which has commuter students or non-residential students. An HBCU, or historically black college and university with residential students, may have different needs than a rural campus with students who travel in for courses. And similarly, considerations should be made for community campuses, non-traditional campuses, military schools, technical colleges, four-year private, four-year public, and religiously affiliated schools, and all the other types that I am not mentioning, because we know there are, this is a priority and a need on all types of campuses. We also heard from folks at our meetings and in the communities that we've worked with that parents, engaging parents as an audience is an important for prevention messages. You know, messages are received and reinforced by parents, and students may look to their parents for guidance and support, and parents may want their children, I'm sure they actually absolutely want their children to have a healthy, safe, and successful college experience. using proactive and social media to get the messages across, meeting students where they are, and where they are is on social media. I hear that students are not using Facebook anymore, which makes me feel very old because when I was in college it was brand new and you had to have a .edu email to even get on. So now I'm like, I don't know what the kids use. But so doing some legwork and finding out where the students are on social media and being proactive about that to get messages out. And finally, encouraging active and visible bystanders, engaging the whole campus as proactive bystanders, standing up and speaking out against violence. Teaching potential bystanders that they have a role in changing the culture and to potentially safely intervene in harmful situations. So those are our key messages in the audience component. Next we have partnerships and sustainability. In this component we're talking about ways to develop healthy working relationships with community stakeholders and partners that can strengthen, coordinate, and align prevention efforts in order to have them be more sustainable over time. We want prevention work obviously to work so that we can work ourselves out of a job, but we want it to be sustainable over time because we know that culture change takes time and may not have a quick fix. So some of the ways to do that are by developing a memorandum of understanding or a memorandum of agreement with community partners. This could be local rape crisis centers or local law enforcement, for example, to clarify the roles that each organization has as it relates to the implementation of primary prevention strategies and responding to violence. We also want to ensure leadership buy-in, so tracking back to identifying champions, getting leadership involved to build buy-in and support can really enhance prevention strategies. Campus administrators and Board of Regents are particularly important when considering developing a full-time prevention position. You want those folks on your side. Leadership doesn't have to just mean administrators, though. These could be student leaders, staff and faculty leaders, and community members. Echoing, just again, because this is so important, that we want to encourage where possible to create permanent staff positions that can be sustained without temporary grant funding to ensure that prevention is sustained and supported. And finally, one more, penultimate. Students have a meaningful role to play in the development, implementation, and evaluation of prevention programming. So creating roles for them at every point. Students can be a great asset for creating messages that resonate and will be heard. They can tell you where they are on social media and how to reach different campus audiences. Students can act as peer educators, peer advisors, depending on how your school wants to handle it. And finally, partnering with health services, student health, wellness centers, local emergency departments. These entities are often the front line for sexual assault survivors, and partnering with them for resources and support is immensely important. And our last component is evaluation. Again, CDC, we love evaluation. We want to know what's working. So where possible, we want to rigorously evaluate promising prevention programs, practices, and policies. This means developing an implementation plan alongside with an evaluation plan to evaluate the questions, the indicators, the data sources, and who's responsible at the end of the day for communicating the results back to the community. Climate surveys are a part of this. The Not Alone, it's no longer notalone.gov. It's now creating our campus, Safe Campus. We'll figure that out, what it's called now. Not Alone took a little turn, and there's a new website that has resources. But they have some delightful campus survey, campus climate survey development tools that you should check out. So when evaluating prevention programming, outcomes should go beyond knowledge acquisition, skill building, and attitude change in order to look at, are we reducing perpetration? ideally, and are we preventing victimization? We see that campuses are have ripe opportunities to partner across faculty and staff for evaluation. Students and staff can become proficient in program evaluation in order to monitor and evaluate what's being implemented. We also really encourage using the intended audience with the research, planning, and evaluation to, again, make sure that the changes that you are anticipating are resonating with the community, and that strategies and evaluation strategies along the way will work. We really encourage using sound theories of change and logic models. I don't know if anyone has a logic model tattoo, but that's something to consider. These are key pieces in prevention planning. So mapping out what will change, by when, and how is a critical way to know if you are achieving the expected results. And a college campus is a perfect place to bridge research and practice because staff, faculty, and students are all invested in finding out what works to prevent sexual violence. So those are the 5 components. Isn't that super exciting? You got to do all of them, which is hard, but you can do it.
Great. Well, they are exciting, Jenny, and I think we want to hear from you all in the audience. You know, given those components and the pieces of the framework, so comprehensive prevention, infrastructure, audience, partnerships and sustainability, and evaluation, and then of course there were many different components that were listed throughout those framework pieces. What components of the prevention framework are you most interested in? What came up for you when you were hearing Jenny go through these things? We would love to know. So if you would use that text chat. And Kelly says that yes, it actually is, Jenny. It is exciting. I think that's what you're referring to, Kelly. So Liz says evaluation, which I love that. Evaluation is one of the things in this framework that we're most interested in. Evaluation is the hardest, Anne says. The hardest, but perhaps, you know, one of the most important, because if you don't know if your efforts and strategies are working, are you wasting time and resources? So let's see, Lindsay says audience, partnership both on and off campus. And Kelly, there was a great example. If you scroll up, Libby was talking about working at a rape crisis center and having MOUs with colleges and universities to do comprehensive prevention on campus. That's great. Tiffany says sustainability and evaluation, which can go hand in hand, I think. If you can show it works, it's more likely to be sustained. Absolutely, Tiffany. Let's see. Engaging proactive bystanders, engaging students in prevention planning and programming. Yes, having that student voice is so important. Partnerships with professionals who provide interventions to individuals who perpetrate. Thanks, Kurt. Thanks for that comment. So there's many things that you all are interested that are coming through. And again, we'll post a link to where you can read the full document and hear more. But thank you all so much for sharing what's interesting you. There's some really great conversation going on in the text chat, and we just really appreciate you being engaged. So Jenny, I'm going to pass it over to you. Back over to you, I guess.
Great, thank you. And thanks so much, folks. It's really helpful to hear what's resonating with you and where there could be some more information collected from communities to share back in the future. So we're going to shift a little bit. You have to hear me talk for just a minute more. But we want to talk about some of these evidence-based strategies that we've learned about in the past decade of research to find out what works to prevent sexual violence. So the Stop SV is our technical package to prevent sexual violence. Thank you, Ashley, for sharing the link. This document came out in April of this year, and it's part of our Division of Violence Prevention's new push to, we don't have all the answers yet, but it's urgent, and we want to get out what we know. So we are releasing technical packages on all our violence types. So the youth violence technical package came out today. Surprise, it's on the streets if you want to check that one out. We have one on child abuse and neglect and sexual violence, and there are more forthcoming. But what's the technical package? Oh, wait, no, first, are you familiar with Stop SB?
Yes. Yeah, so Jenny, we want to hear from the audience again. And are you familiar with the technical package to prevent sexual violence, Stop SV? So I have put that feedback box back in the bottom left corner for you all to answer. And it looks like we have about a third of you all answering. And it looks, I'm going to share the results if I'm not already doing that. Oh, I think I already am. So you'll see that 60% are not familiar with the technical package, but somewhere hovering around 40% folks are familiar. And so if you're not familiar, I have put that link to where you can access Stop SV, a technical package to prevent sexual violence. Thank you all for sharing in that. And then I think, Jenny, the next question that we want to hear from people about is, if you are familiar, and that doesn't necessarily mean that you've read it and you know it inside and out, but if you're familiar with what's in the technical package, what plans do you have to use the technical package in your work? We would love to hear, do you have plans to do this? What does that look like? And maybe that's having conversations with people that you partner with, or maybe you have some more substantial plans. So if you would let us know, we would appreciate that, and we'll see what folks have to say as we move on. So I think at this time, Jenny, I'll pass it back to you, and we'll let folks kind of think about that and answer, and then we can hear what folks are saying in a little bit.
Yeah, for sure. And as we talk through the different strategies that are in the package, it may bubble up for folks like how they already are implementing it or plans that they have that they may not have realized were part of this technical package. So, just to back up for a second, technical package is sort of a terrible title for what these are. I probably shouldn't have just said that on a recording, but even our division director says it's not super descriptive for what it is. But basically, a technical package is a collection of strategies that represent the current best available evidence to prevent or reduce a public health problem like violence. So these are done throughout the Centers for Disease Control and Prevention for a variety of health topics. And as I said, this is something that we're adopting now as part of our portfolio of work. They can help to improve the health and well-being of communities by outlining activities the public health or other stakeholders can implement to see reductions in violence or violence-related risk factors in communities. So Stop SV includes primary prevention strategies as well as approaches for responding to sexual violence as part of a comprehensive approach that our stakeholders and partners may implement. So on a college or university campus, it's important to implement strategies and approaches that have evidence of effectiveness or have shown to impact those risks and protective factors for sexual violence. And in the technical package, there are some strategies that could be applied to a campus setting. The approaches listed in the technical package may or may not have efficacy specific to a campus context, but many approaches could be tailored for the settings and still be promising for sexual violence outcomes. So I'll talk through the 5 strategies and some of the approaches that have bubbled up and may be applied to a campus setting. So on this slide, you see the acronym Stop SV and the approaches. We'll go into more specifics so you can actually read it. So the first strategy is promoting social norms that protect against violence. So the approaches that we outline in the technical package here are bystander approaches and mobilizing men and boys as allies. So I'm going to talk through specifically how these could be applied in a campus setting, but if you go to the technical package, you'll see many other examples for middle schools, for community settings, for high schools, and for other age groups. So, but on a college campus, here are two kind of ways that these approaches could be implemented. So bystander training, it sounds like folks from the text chat are very familiar with this. It's an evidence-based approach to preventing sexual violence on college campuses. These programs are useful because they engage both men and women as potential witnesses to behaviors that can increase risks for violence and train them to safely intervene or speak out against social norms that support violence. So providing bystander skills training for students, staff, faculty, and administrators can be an important part of any comprehensive prevention plan. You could also implement media campaigns that model appropriate student behavior and conduct, like what bystander skills might be useful at a party, or how to consent to sexual activity. Mobilizing men and boys as allies is an approach that we see quite a bit in middle school and high schools, but tailored to fit a campus setting. You could engage male coaches, sports teams, fraternity men, to learn positive, healthy norms about masculinity, to prevent perpetration, and to learn how to support survivors in their communities. So the second strategy is about teaching skills to prevent sexual violence. So in the technical package, we talk about 4 approaches: social emotional learning approaches, teaching healthy, safe dating and intimate relationships, promoting healthy sexuality, and empowerment-based training. So, we see campuses teaching students about healthy sexuality practices and providing definitions of consent. One way that campuses are doing this is by implementing affirmative consent policies, which Ashley mentioned. There was a fantastic web conference earlier this year about how campuses are doing this, so I encourage you to check that out for more information. But affirmative consent means that consent to agreed upon sexual activity is freely given by all parties involved by words or actions, and an affirmative consent policy outlines the definition of consent and makes it known to students, staff, and faculty. So making sure that it's widely advertised as policy on campus. Also, I saw in the text chat that folks were talking about empowerment-based training or self-defense courses. There are some evidence-based empowerment-based trainings for preventing victimization. So that may be something that you want to look at on your campus. And I know we could spend, hours talking about that, but I did just want to mention that that's included, and check out the technical package to see, more on that. The next strategy in the technical package is providing opportunities to empower and support girls and women. So, again, the technical package talks broadly about community and societal level approaches, such as strengthening economic supports for women and families, and strengthening leadership and opportunities for adolescent girls. Applying this to a campus setting, though, leadership programs for women on campus that build confidence and leadership skills can mean better education outcomes while in school and better employment outcomes after college. This may contribute to women feeling more engaged in their community and in politics. Sorority women could implement programs to emphasize strong voices and leadership skills, to change gender and social norms in Greek life that may contribute to sexual violence, and shifting those could contribute to prevention. Also, women's centers and departments of women's and gender studies are places that promote gender equity on campus, provide women with leadership opportunities in order to reach their full potential, and are a safe space to learn and research sexual violence prevention efforts. That's a plug for you to do some research on your campus. The presence of women's centers programming and gender studies courses on a campus promote awareness of social constructs like social justice, gender, race, economic status, sexual orientation, and women's health. All things that we want to promote on a college campus. The next strategy is about creating protective environments. So again, in a community setting or nationwide, improving safety and monitoring in schools, establishing and consistently applying workplace policies. In the technical package, this refers specifically to sexual harassment in the workplace policies and addressing community-level risks through environmental approaches. So on a campus, this may look like enacting a policy that includes prevention messages in new and transfer student orientation, on campus tours, having classroom trainings, social norms campaigns, and events throughout the year. This also could be having really strong codes of conduct, and that the codes are widely available in student handbooks so that faculty, staff, and administrators are reinforcing these codes and modeling appropriate behavior. School leadership should consistently and fairly enforce this student code of conduct. Additionally, sexual assault policies and reporting procedures should be easy to find and navigable on a college or university website. And then, in terms of environmental approaches, addressing those community-level risks, policies that reduce access to alcohol on campus and surrounding communities may be useful for reducing rates of sexual assault. We're learning more and more about how alcohol policies impact sexual violence. We're learning more all the time. So we think that this could have some impact on campuses too, because we know although alcohol use does not cause sexual violence, excessive use can increase the risk for perpetration or victimization. So colleges can work with partners and advocates in the community to limit the number of alcohol outlets, like bars, liquor stores, package stores, adjacent to campus, or to increase enforcement of laws to reduce underage drinking and over-service. Or campuses may want to explore dry campus policies that do not allow alcohol to be consumed on a campus and therefore may decrease binge drinking. Another piece that we've heard about colleges doing is about instituting drug or alcohol amnesty policies for sexual violence victims or bystanders to decrease barriers for students who come forward to report sexual violence. And finally, this is the last you'll hear from me for a little bit, the final strategy is to support victims and supporting survivors to lessen harms. So in the technical package, we talk about victim-centered services, treatment for victims of sexual violence, and treatment for at-risk children and families to prevent problem behavior, including sex offending. So on a campus, this can look like staff and faculty being trained on trauma-informed response and campus policy and practices to compassionately and effectively handle disclosures when they occur. Faculty and staff, can be prepared to provide a list of resources. They can put messages in their syllabus at the beginning of the semester about resources and disclosure, and point to students to local law enforcement and campus law enforcement if necessary. Survivors of sexual violence who seek help or intervention from their college or university, we hope that they encounter a system that provides coordinated, confidential support and addresses their needs in a non-judgmental environment. So students should be made to feel confident and safe in reporting based on the policies and accessing available resources. And finally, we want to point to the fact that we really encourage the campus process to hold perpetrators accountable. This means making the student conduct process and consequences transparent to students. It means ensuring that faculty, staff, students, and law enforcement are knowledgeable about sexual violence policies and the adjudication process. This is also an option to hold perpetrators accountable through local criminal justice processes and that are separate from campus procedures. So again, this is not comprehensive. These are not all of the strategies for a college campus to implement. Those are just a few of the pieces that map on to our Stop SV technical package that we thought would be useful in highlighting for you for this web conference. So I think my turn now is to hand it over to Mighty Fine, our friend at the American Public Health Association, to talk through how our campus and rape prevention education partners took this kind of guidance, took these takeaways and put them into action. So off to you, Mighty.
Great. Thanks so much, Jenny. So thanks again to everyone for joining us today for this very important topic. I am happy to be a part of the conversation. So as Dawn mentioned at the top of the hour, I will talk with you briefly about utilizing the action planning process in campus sexual assault prevention efforts. Just as way of background, as we all know in public health, we have so many competing priorities, and in some instances, if we look at the totality of everything that we need to do, the task will sometimes seem insurmountable. So action planning is a way to alleviate some of that anxiety that we have in planning programs. And so essentially it helps us to be strategic in maximizing our sometimes, often limited resources, and helps us to home in on what we're actually trying to achieve. And action planning makes us focus on what is actually achievable. So again, the process helps us identify what steps need to be taken in order to achieve the goals that you have identified. And the planning process, throughout the process, also helps to clarify what resources are required to reach the goals you've identified. And it keeps you in line with also developing a timeline for when specific tasks need to be completed and determining what resources are required for those tasks in particular. So essentially what it does, it gives us the big picture framework, but it also helps us to keep track of those important details. So as Dawn also mentioned, we have 15 teams that went through the action planning process, and as way of background, they spent 2 days with us in Atlanta, 2 very full days, but I would like to think 2 very productive days as well in Atlanta, and I'll refer to those group of people as Cohort 1. And what I'll do is I'll just give a very brief snapshot of some of the steps that we engaged in, and hopefully encourage you all to use action planning in your prevention efforts as well. So just one of the first things that we worked on at the action planning meeting was actually developing a mission and vision statement. And specifically for these teams, as Dawn mentioned, they were led by the RPE coordinator, but there were also some teams that had not worked together as closely before, so this action planning meeting gave them an opportunity to really pool their intellectual resources. And I think in developing a mission statement was critically important for those groups because they hadn't worked together before as intimately, and they come to campus sexual assault prevention from different aspects, and developing a core mission statement helps them all to get on the same page as to where they're trying to move their team forward. And some of the guidance that the teams were given were obviously to not make the mission statement too lofty, remembering that we're working towards something that's actually achievable. And so we joked and said that the mission statement should be something that you're able to tweet. Some teams are more successful than others in getting their vision statements down to 144 characters or less, and some were not as successful in that, but I think they were still concise enough. And so we felt in the action planning process, once you actually have your mission, your vision, and your direction, you can actually start to move into some of the planning. And as you see here, we had an algorithm where teams were able to identify the importance of their goals, the feasibility of their goals, and they prioritize and rank their goals. Again, thinking about teams who come from different aspects of campus sexual assault prevention, this helped them to, in a fair way, I would say, rank and prioritize their strategic goals. And we also realized once the goals were prioritized it was important to actually streamline them. So essentially the teams had to ask themselves, okay, the what, the who, the when, what resources and what communication strategies are we going to use? So moreover, what is being done to bring about change? Who is accountable for the completion of the activity within the team? When will it be accomplished? Again, getting back to that timeline. And what's the projected time for this to all take place? And then obviously thinking about the allocation of resources for all those goals that they've identified. And what we've also tried to do throughout that process was remind the teams when they're going through the process, they should always thinking about the evaluation plan and the end in mind in confluence with the mission and vision to make sure that the evaluation and what they're looking to achieve is a driver of their program as well. The next portion, as Dawn also highlighted earlier on, we went through the teams and we did a SWOT analysis. And essentially, as I'm sure you all know, the SWOT analysis is really just a process or a tool to help teams to figure out what their strengths are, weaknesses, and thinking about opportunities and some things that may get in the way of moving forward in their planning. So some of the questions that the teams pose to themselves: what advantages do the colleges have or having college representation on their team? What are some of the collective limitations among all team members in the industries that they represent? And flipping this analysis on its head and thinking about, okay, what opportunities lie within our strengths? How can we leverage what we're all collectively bringing to the table? And as Jenny mentioned, this SWOT analysis activity was done for all 5 of the elements of the prevention framework: the audience, evaluation, comprehensive prevention, partnerships and sustainability, and infrastructure. So as you can imagine, going through all 5 of those dimensions gave the teams a lot of information from which they could work in to start developing their action plans. So speaking of action plans, again, another point of clarification, condensing these 2 days into just a few minutes, but when Ashley sends out the slides, she will also send out a copy of the action planning document that the teams went through that will hopefully lend itself to your planning process as well, and it'll accompany kind of my explanation of it, but definitely be more in depth. And you can always feel free to reach out to me if you have any specific questions on that. But as far as action planning activities, the teams, some of the teams went on to do mini action planning meetings. Some of them went on to do violence prevention summits. They did coalition development, again, sort of like a mini action planning meeting, bringing together a collection of all of those with a vested interest in campus sexual assault prevention and having them figuratively at the table. Some teams also did classes on violence prevention, and then others did collected information on campus sexual assault, some that was provided at the action planning meeting, some that they collected on their own and found unique and new ways to disseminate that information out to partners and other interested stakeholders. So just quickly, some of the lessons learned from Cohort 1, which I think would be of no surprise to you all. There is a necessity of educating high-level decision makers. So this was learned throughout their action planning process, and some of the programs or activities they implemented went to address some of these lessons learned. Obviously, there's a critical role of campus climate surveys and other data gathering efforts to inform program planning. There was also a big need for campuses to take ownership of its prevention program. And related to that, the strategic involvement of students, recognizing that there's a clear role for students in these efforts, but identifying where that role is and not having students involved just for students' sake, but actually giving them a critical role in the prevention process. Obviously, the value of pooling resources and highlighting the importance of primary prevention. So with Cohort 1, as I mentioned, the existing action planning teams, they've gone on to do some great work that they had in motion that the action planning actually helped to bolster somewhat. And so CDC and APHA we were working with them throughout 2016 into 2017 to track their progress in their current campus sexual assault violence prevention activities. Teams will also track and monitor the components of the sexual violence campus strategies for prevention, the technical assistance doc that Jenny went through, and we'll be working with them to see how their activities align with what some of the recommendations are in the document. And it's also going to be working to expand capacity to implement evidence-based and informed strategies from not all the 15 teams, but some of the 15 teams that participated in the action planning meeting. And we're happy to announce that in 2017 we will be hosting another action planning meeting. So at the top of the year in January, please be on the lookout for a request for proposals. We'll again be looking for teams of up to 5 people, which will be led by the RPE coordinator of that state. we encourage states that are at all process or at all levels of implementation to apply, and we're hoping that by engaging you all in the principles of action planning, we can help to move that work forward. And that's it for me, but I'll turn it over to Dawn to talk about, or Ashley, I'm not sure, to talk about the, okay.
Thanks, Heidi. Thank you
Okay.
so much. So, Dawn, I know that we are planning another Prevent Connect Campus web conference early in 2017, and it will be looking at the work that you all have been doing on the historically Black colleges and universities Sexual Violence Climate Survey Project.
Exactly. That's correct, Ashley. And we just want to put folks on notice to stay tuned, to look for that announcement. This is one of those targeted settings that we're paying close attention to, and certainly in partnership with the Department of Justice, the Office on Violence Against Women, and the National Institute of Justice, which is a partnership that is unprecedented in ways. But as a part of that web conference, you can expect that each of the entities will be providing information regarding their efforts and activities with HBCUs. And we know that a lot of our RPE grantees, as well as existing predominantly mainstream white institutions, are working alongside the HBCUs in their states. And so being able to provide sort of missing information where this kind of gap exists and what it may mean for other minority-serving institutions as well, and providing the lead-in for those efforts and activities, too, to focus on other campuses. So just, look for that, and we're excited to say that'll be the follow-up as a part of the knowledge and research that will be happening out of CDC's portfolio.
Great. Thank you so much. So in the few minutes that we have left, I just wanted to circle back, Jenny and Dawn and Mighty, to the question that we asked about how folks plan to use the technical package in their work. And so there were a couple of responses. Olivia said they're planning to use strategies from various curricula included in the package to adapt to an existing SV prevention curriculum used here in Puerto Rico. Rebecca Klein said making sure IPV is not ignored in the discourse about campus SV is how I intend to use it. Brittany said that they disseminated the resource to the Campus Sexual Assault Policy and Prevention Initiative grantees. And then Beth said that they've been using Connecting the Dots document and the new TA package in concert for program planning. So those are some of the things that came out of that question and how folks are planning or are already using it. And since, as Jenny went through and you saw kind of how it's being put into practice through Mighty's presentation, if there are other things that have come up, please feel free to let us know what you plan to do in that text chat. And Christine, yes, there is a youth violence technical assistance package available, and I put the link in, but I'm sure it is well buried now. So we will put another link where you can find that. But there's been some really great connections being made in the text chat I've been seeing, a lot of resource sharing. Thank you so much, Dawn, Jenny, and Mighty, for the important knowledge and tools, and then sharing of how to put this all into action through that action planning process. And I will be sending out a link with the slides, a link to the recording, and that action planning workbook that Mighty mentioned. So stay tuned for that in the coming shortly to your email box. But I just want to see any closing thoughts from the three of our guests today. And thank you all again for joining us. This was a fabulous session.
Hi, Ashley. This is Dawn. Just on behalf of CDC, we know that this is a lot of information, a lot to deconstruct and digest. We are grateful for the opportunity to put our efforts out there in this kind of forum. We're hoping that folks can see and distinguish the pieces of knowledge and think about what's meaningful for them via the two documents from CDC, the technical assistance document and the technical package, and then be able to access whatever the links that you're going to provide to the various tools and documents. And also that if our colleagues and friends can stay tuned again for the reporting of research findings that's coming out of CC's funded projects and findings from, again, the action planning project. We hope to disseminate that information. And just, overall, we want to thank you, Ashley and Meghna from Prevent Connect. Thank you to Jenny, certainly, and all of our amazing CDC colleagues who work with us and have led or contributed to all of the efforts and products here, to Mighty and APHA and his partnership, and to all of you in the field, from public health to education to community-based settings and all of the entities that I'm missing, wherever you are. We know that we are all partners to keep our students safe, and certainly for sexual violence prevention. So we're grateful for you. We all matter to each other's efforts, and so we're thankful for that. Thank you for joining us, and stay tuned.
Great, thank you. Thank you all again. We will be sending out materials and dates for you to join us again. We hope that you have a wonderful rest of your day, wherever it may take you, and we look forward to connecting with you on a future Prevent Connect web conference. This concludes today's session. Take care.
Thanks.